Hello and welcome back to the channel. Today I want to talk to you about something incredibly important that sits at the very heart of what we do in geriatric oncology, the patient experience. Specifically, the experience of being assessed. I recently received some feedback from a patient, not my own, but about a process very similar to ours. It highlighted a critical gap between why we as doctors do certain tests and how it can feel to be the person undergoing them. The patient described their geriatric assessment, a series of questionnaires and tests to prepare for chemotherapy, as intrusive and at times demeaning. They mentioned a lifetime of test anxiety and how emotionally charged the subject of memory is. They felt the process itself did not account for the human being on the other side of the clipboard. And they are absolutely right to feel that way. This is a conversation that we need to have openly and honestly. And frankly, it's a conversation I feel uniquely positioned to lead. For over 2 decades, my entire career has been dedicated to the care of older adults with cancer. I've not only conducted thousands of these assessments, but I've also spent years writing, teaching, and building resources like this very channel, all centered on bridging the gap between clinical medicine and real-life experience of aging with cancer. My goal has always been to see the whole person, not just the disease. So when a patient gives us feedback this clear, we have a professional and moral obligation to listen and to learn. So let's pull back the curtain. What is this intrusive process? It is called a comprehensive geriatric assessment, or CGA. It's not a test to pass or fail. It's the single most important tool we have to create a truly personalized treatment plan for an older adult. Yes, we ask deeply personal questions about your daily life, your support system, your mood, and your memory. We watch you get up from a chair and walk a few steps. We ask you to remember a few simple words. From the outside, I understand how this can feel. Redundant, intrusive, even at times demeaning. But here's what's happening from our perspective. When we ask if you can manage your own finances or medications, we are trying to understand if you're able to handle a complex chemotherapy schedule at home. When we test your physical strength by asking you to stand from a chair, we are not judging your fitness. We are calculating your body's physiological reserve, your ability to withstand the stress of a treatment and bounce back. A simple test like this can predict the risk of severe side effects much better than knowing your age. And the memory test, yes, this is the most sensitive of all. The patient who shared their feedback was right. Memory is an emotionally charged subject. For many, it is tied to identity, independence, and fear. So when a doctor asks you to draw a clock or recall 3 words, it can feel a high-stake exam you didn't ask to take. I want to be very clear about this. This is not a diagnostic test for dementia. It's a screener for subtle cognitive changes that could make a specific cancer treatment unsafe. Some chemotherapies can cause confusion or delirium. If we see a small flag on a memory screen, it doesn't mean that you cannot have the treatment. It means we need to choose a treatment that is safer for your brain or build in extra layers of support for you at home. The purpose is not to label you. The purpose is to protect you. But knowing the why doesn't automatically erase how it feels. This patient experience shows us that we as healthcare professionals must and should do better. For my colleagues, doctors and nurses, we need to preface every single one of these assessments by explaining the why. We must say, I know these questions are personal, and the memory part can be stressful. This isn't a pass or fail test. This is a tool for us to design the safest, most effective treatment plan specifically for you. We must acknowledge the anxiety in the room before we even begin. And for patients and their families, I want to empower you. You have a right to say to your doctor, this part of evaluation is making me anxious. Can you walk me through why you're asking me to do this? A good geriatric oncologist will welcome that question. Your feelings about the process are just as important as the data the process generates. You are a partner in this, not a subject. The science behind geriatric assessment is powerful. It allows us to give more older adults effective and safer cancer therapy and minimizing harm. But science without compassion is poor medicine. The patient's feedback was a gift. It reminds us that behind every questionnaire, every physical task, and every memory test is a human being with life story and anxieties and a deep desire to be seen and respected. Our challenge is to honor that humanity while using our best scientific tools to care for them. Thank you for listening to this very important topic. If you have ever had experience like this, good or bad, please consider sharing it in the comments below. The more we talk about this, we can provide the better care.